Good day, everyone. It is a pleasure to be here with you all today, even despite the challenges that we are facing now. What I will be talking about is exploring experiences of PrEP users, especially when they try to access PrEP service, and trying to answer that question. Is PrEP really for me? It's very easy to ask a client to ask them and say, oh, PrEP is really for you because it gives you protection for HIV infection. But exploring their experiences on what they have explored when they accessed or they are trying to access PrEP is a different story. And that's what we will be exploring in this presentation. Globally, as we can see, the trend with regard to PrEP initiations is actually increasing. And this is what we want, of course. We want more people, more HIV negative people to access PrEP so that they will be protected against HIV infection. While it's already at the 1 million mark, it's still actually very low as compared to the targets that were set by the UNAIDS, that is around 3 million. So we wanted to reach more people so that they can choose PrEP as an effective way for them to prevent the possibility of having HIV. As what we can see worldwide, there are many countries already that are offering PrEP, but as you can see, there is still disparity with the distribution of PrEP globally. As you can see in our region, the Asia region, there's still countries that are not yet initiating or offering PrEP in their as part of their HIV service delivery. And while there are most countries are already have started offering PrEP in as part of their suite in delivering HIV service delivery, it's still not enough. We want to offer PrEP to many countries, to many locations as possible. It is because we wanted more people to have access for prevention as part of their daily lifestyle. And I remember when we were initiating or starting PrEP in the Philippines, when we have reached our conclusion part in our demonstration project, one of our co-investigators, Dr. Fritz von Greenspan, he actually made the statement that this pill can actually make a difference, and this pill, can protect us from having HIV infection. It is easy to take, actually. You just need to take it daily. You just need to take one pill. Or even though there are other instances where we offer our clients another option, which is event-driven or on-demand option. The important thing is if we will be spreading the use of PrEP to all those who are HIV negative, we can actually stop and end the HIV epidemic. However, we are not there yet, of course. And, that's why this is one of the reasons why we have this forum, this symposium, for us to initiate and talk more on how we can offer PrEP to everyone who needs it. And we understand that as service providers, most of us cannot offer PrEP as hopeful as we want it to be because there are many challenges. And my presentation today will be exploring those challenges that are experienced from potential users and all that are already taking PrEP as part of their daily lifestyle. And we wanted to explore these comments, what we have made, not only in our service delivery in our clinics, but also what we have seen online when we try to ask PrEP users on Twitter, what do they think about their PrEP experience? Most of the clients actually have, especially those who wants to take PrEP and who are already accessing PrEP, they're actually very positive, and they are ensuring that they wanted more confidence in having a proactive management of their overall health and wellness. So as you can see in some of the users here that you see on the screen, some of them are, are very much responsible in having that sense of protection, not only for themselves, but also a sense of protection that they don't want to spread HIV if, if they had HIV, or if their partners are potentially having HIV. They are more confident with using PrEP because, first, of course, it minimizes the risk of acquiring HIV, and they feel that they are more confident in how they interact with other people, because they feel that that confidence is provided by their responsibility in taking care of themselves. But there are, of course, other people who views PrEP as one way for them to be empowered in striking a balance between the safety and the satisfaction of the sexual activities that they are doing. They feel that they are sexier because they are protected by PrEP. They feel that a confidence boost is given once they are protected against HIV infection. And of course, one way to see it also is that these people who are more empowered in having a sex positive behavior, some of them, of course, view it as they would want to have sex without condoms. And that's one thing as service providers for us to remember, that we should remember that if we provide our clients PrEP, even if they do not use condoms, they are actually engaged into protected sex because they have access that protection for them to protect themselves against HIV infection. And that's one way to view it. We should be viewing it in a sex positive way, and we do not view sex as a bad thing, as something that we should be normally talking about. And viewing sex as a bad thing actually affects experiences, not only to clients who would want to access PrEP, but also to clients who are already taking PrEP. There are instances, especially in our community centers, where we feel that clients may have both internal and external shame that they experience while they are wanting to access PrEP, or while they are already into PrEP. First, what we have seen is that some of the clients are it affects their access to protective behavior. Some of the clients that we have asked to take PrEP says they don't need it, or they are not promiscuous, or they feel that they have that judgment that only sexually active gays need it. So it's actually influenced somehow by external stigma, where the society views that sex is shameful, that it is a bad thing, and having multiple sex partners is a bad thing. And that also connects to the notion that they may have multiple partners, especially for those who are already taking PrEP. There are instances where we interviewed a Twitter user that has posted on his profile that he is on PrEP, but there's already a surge of followers messaging him that's saying that he is a slut. So what he did is that he removed that on his profile that he is on PrEP, because there is a shame in himself saying that he may have multiple partners, which is necessarily not a bad thing. And adding it on their public profiles actually opens educational opportunities for other followers. But since he receives these messages, he just decided to remove them. Another client actually disclosed to us that disclosed to his partner that he is on PrEP. And his partner did not take it lightly, because he has a judgment that his partner has his partner has so many sex partners and is not loyal to him. When we asked this client what is his motivation in accessing PrEP, what he told us is that he just wanted to protect himself from having HIV. And that's not necessarily having multiple sex partners. He just wanted to access PrEP even though he is in a relationship, because he wants to be protected. And that's a responsibility of accessing and managing his overall sexual health and wellness. There are also clients that they are posted that they are using PrEP on Grindr, but he is actually having less partners on Grindr, saying that they have this notion that he has too many sex partners. There is a notion that, if someone is taking PrEP, automatically they have multiple partners, which is not the case. And speaking of education opportunities, one thing, of course, that we experience also, there are clients who are unaware of what PrEP is, and they are receiving messages assuming that they are HIV positive and they are under medication. I think there is a learning opportunity here to share that if they are taking PrEP, they are actually HIV negative. And there are other scenarios actually where a client received a message that they are actually a syphilis spreader. And this is actually connected to the rise of incidents of having sexually transmitted infections while they are on PrEP. And I think it's very important to note that even before PrEP was introduced, actually, STIs are already on the rise, and it may be aggravated by PrEP, but I think it's one way to explain to our clients the advantages and disadvantages of accessing PrEP. I think it's one way to explain to them that it protects you from HIV infection, but not from other sexually transmitted infections. And of course, there are other situations where they assume that PrEP clients are sex workers and they need protection, or there are clients actually asking them, why are they on PrEP? Or is your partner HIV positive? Assuming that they are already in a serodiscordant relationship. And as what we can see, there are many educational opportunities here. And speaking of educational opportunities, what I can share to end my presentation is, of course, to share highlights on what we can do as providers and as friends when we know that there are clients who are, and when we know friends who are actually considering taking PrEP or actually already taking PrEP. As service providers, I think it's crucial for us to explore empowerment messaging in our key messages and our demand generation strategies. It's also one way to include empowerment messaging to share to our clients that our health is always our responsibility. And of course, as service providers, we should also be guiding our clients on how to make PrEP fit to their lifestyle so that they will adhere to their medication, ensure that they take PrEP as needed. And of course, that includes disclosure to the people that they trust. And finally, as friends of the community, I think we should explore discussions viewing that sex is not taboo. If we view sex as taboo, we also, we do not discuss other issues that are attached to sex. Like, for example, discussing the rise of HIV cases, or discussing teenage pregnancy, or viewing how to protect yourself against these, how to manage your own sexual health and wellness. We should view sex as not taboo so that we can able to discuss conversations that are attached to it. And of course, mutual respect and understanding is really important so that we recognize that they use PrEP as an empowered choice, and it's an opportunity for us to ask so that we could learn more instead of judging our friends. And that ends my presentation. I hope that we could discuss more in our conversations as we explore more that PrEP is, yes, it is for you. That's the question that we always want to answer, and explore that PrEP is actually a way for you to have a proactive management of your health and wellness. Thank you very much.